Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of this show, I'm going to continue talking about lupus. Now, in this segment, actually, I'm going to begin to evaluate a young lady who I suspect might have lupus. And this will give us an idea how we really go about evaluating someone who we suspect might have lupus. What are the things that we're going to do? This is a 22-year-old NEGRE / African-American female who presents with weakness, very tired, have trouble sleeping, headachy, having low-grade temp every now and again, doesn't know what's wrong, she just doesn't feel right. And she also lately began to have her hair begin to drop off. And that's the main reason why she shows up to be evaluated. She's 22 years old. She's a young lady in the childbearing age, as I mentioned before, and she's African American, which is the group that's get affected by lupus more than any other group. Across the world, there's 5 million folks with lupus. In this country, 1.5 million folks with lupus, most of them female of childbearing age, mostly African American. And every now and again, you might find a Caucasian female that might have lupus, and rarely a man has lupus. Lupus is pretty much a disease that is associated mostly with women of childbearing age. Take the history from her, complete history, the work history, smoking history, alcohol drinking history, family history, surgical history, so on and so forth. Has she had children, so on and so forth. Then one examines her, you clearly going to complete physical exam, you're going to take the weight, take the height, take the blood pressure, the temperature, the pulse, respiratory rate, etc. Then of course, the first organ that you're going to look at, which is the biggest organ in the body, of course, is the skin. And the skin frequently, not always, but most frequently is affected by lupus to one degree or another. Of course, you examine the skin from the head all the way down to the toe, examine the hair. And sure enough, she has a little bit of alopecia, which is an area where the hair has lost, and you could actually see the skull very easily because there's an emptiness there. Take a look at the brows, because frequently individuals with lupus will also begin to lose hair in the brow without themselves actually realizing it. You evaluate all that. Take a look inside the mouth, inside the nose, examine the ears. Take a look in the throat. Examine the thyroid, the carotid. Listen to the lungs. That is, of course, after you've taken the blood pressure, etc. Listen to the lung, listen to the heart. Examine the abdomen. Check the pulses, do a complete neurological examination. Then you pretty much do your exam and you question her about her GYN. When was the last time she saw the GYN doctor? When was the time that the GYN doctor examined her breast? I don't examine women's breasts in my office. Then you begin to start putting things together. You're going to do a complete blood count. You're going to do complete blood chemistry profile. You're going to do a urine analysis. Complete urine analysis. Then those are the routine. You're going to do a PT, INR. That's very important because sometimes these individuals have coagulopathy associated with the issues. Then you're going to do a sedate. You're going to do an ANA. And the ANA, and then let me tell you, basically, when you do your ANA, and then you're going to do an ENA. And it's very important to do a double-stranded DNA, crucial. You cannot diagnose lupus without the double-stranded DNA being positive. You do a double-stranded DNA, you get an RNA done, and you proceed to, of course, get a CPK, total CPK, do the LDH. Crucial that you do that. Do a you do a quantitative hemoglobin electrophoresis. It is unacceptable to be meeting a person of immediate African ancestry without doing the quantitative hemoglobin electrophoresis, because many of the problems can be associated with that. You can be picked up, and the hemoglobin electrophoresis is a quantitative if you know how to evaluate it. You do quantitative hemoglobin electrophoresis, and then right away, right up front, you don't even have to bother to wait. Get yourself a reticulocyte count done, add that to that. And I did mention the LDH, the CPK, and I'll tell you why these things are crucial. That's pretty much the basic. Make sure she's not pregnant. You do a pregnancy test. Blood, always do a blood pregnancy test. And these days, being that we're in the middle of the COVID-19 pandemic, you might as well put an order in for the nasal swab. Also, you're going to do the antibody test, because she may have had the COVID-19 without realizing that those symptoms were associated with it, but the antibody, though it's not 100%, would help you to pick that up if she had it weeks ago and she didn't know. You do the swab will tell you something immediately going on. The antibody will tell you she had it a few weeks ago and she didn't know anything about it. It's not perfect, but that's the best we could do. Now that you've done all that, as far as the laboratory is concerned, then you're going to do an EKG. You're going to do a chest x-ray. That is very crucial. You can't be doing chest x-ray on a woman of childbearing age without first ruling out a pregnancy, because you can expose her to radiation if she's pregnant. So that's why you do all these other tests first, and then of course you get your EKG, your chest x-ray. And very importantly, you're going to do an echocardiogram, because as I said, this is a multi-system disease. It's a system, that's where the word systemic comes about. There's no organ in the human body that cannot be affected by lupus. You get all this stuff together, get it done. And now you're going to send her home and begin to bring her back next week, and some of your results is going to start coming in. If she is very symptomatic in terms of aches and pain, it's okay to give her an NSAID to get started to see if that will relieve the pain. Naproxen will be fine. 3 times a day, 250 milligrams and so on. Get her started. If she's got issues with that, then you could give her Celebrex just to get her started. Something to relieve the aches and the pain that she's starting to feel. Then, of course, things started to come back. A week later, you get your CBC. Oh, by the way, I forgot to mention the ferritin. You have to do a ferritin. When the result comes back, as expected, she will be anemic, because she's a woman of childbearing age. She's menstruating. She's losing a lot of blood every month. And then the ferritin will tell you that as well. She's 22 years old. She's going to wind up, inevitably, she's going to have a low ferritin, unless she's got some other disease that can cause you to have it. She's going to have low ferritin. So she's anemic, and the ferritin is low. So that's iron deficiency anemia. And you got your SED rate comes back. SED rate is elevated. SED rate is high. Why? Because this is an inflammatory disease. You cannot have an inflammatory disease in the human body don't have elevated SED rate. So the SED rate is going to be high. Then you did other rheumatoid factor. That comes back negative. Okay, fair enough. Now, your ANA comes back positive. Okay, the different characteristics to the ANA. But you were prudent enough, smart enough to also order an ENA. The ENA is going to come back with a whole bunch of subgroup things in it that are either negative or positive. And then Aha. Now you got your double-stranded DNA, because the ENA has to be is divided into two parts, but your double-stranded DNA comes back positive. Whatever else is going on, you've just diagnosed lupus. Just because your ANA is positive doesn't necessarily mean you have lupus. You have to subdivide it to find out the history, because a lot of folks have ANA that's positive and they have nothing acutely going on. So you have to know that you have to divide the ANA by doing the ENA, extractable nuclear antibody. You do that, and then when that's divided in two parts, one part may be okay, and the other part is not so okay, that's when the double-stranded DNA sets in, right there. Because you could have that, and yet it's not lupus. It could be something else. It's crucial, but it doesn't have to be lupus. It could be a long list of other autoimmune diseases that are rheumatological in nature. I've talked about this in the past, and I'll subdivide them for you in time. But your double-stranded DNA comes back abnormal, then you've just diagnosed this young lady with lupus. Okay? And of course, remember, your chemistry is crucial, because you got to check out about, now you really have to focus on the kidney profiles in terms of the blood test. Urine analysis is very crucial if you know how to interpret urine analysis. And of course, you take a look at the chemistry profile, not just for the kidney part of it. You're going to look at the liver, because the liver can be affected by lupus if the liver function tests are normal. Okay, I mentioned LDH, SGOT, SGPT, alkaline phosphatase. All these things are crucial. It's going to be able to tell you if this thing really has gone so far to the point now these liver function tests are abnormal. Crucial thing. And I mentioned before about kidney. For a reason that is not clear, the kidney is crucial when it comes to lupus for whatever reason, and I don't pretend to know the reason. The kidney seems to be the organ that can get people with lupus into the most, besides the blood itself, and the quickest problem. How do you know there's something wrong with the kidney? Well, take a look at the albumin in the urine. If there's protein in the urine, that's beginning to tell you there was no blood and there's protein. So therefore, the protein can only mean that there's a problem with the liver, with the kidney. And there's another test we call microalbumin. We could evaluate for that as well. That's even more crucial. So now that you take a look at the urine, take a look at how many red cells. She was not menstruating. She was not premenstrual. She's got a bunch of red cells in the urine. That shouldn't be. She has CAS, something called CAS in the urine. That's not a good thing either. That's beginning to tell you there's problem with the kidney. The kidney is getting affected. Then of course there's a whole different thing you're going to have to do to evaluate the kidney. You have to do an ultrasound. You got to do a 24-hour urine creatinine, and so on and so forth. If you're not very good at that, please refer her to a nephrologist, which is a kidney specialist. They'll take over that part of it to make sure that this young lady hasn't really gotten serious kidney problem. Because you see, the problem with the kidney, you don't feel pain. You don't feel pain. You have kidney problem. I mean, if you have kidney stone, you're going to have pain. But other than that, you don't have pain. And yet, your kidney is getting into trouble. That's when you really, because there's a lot of stuff you're going to need to do to manage that kidney insufficiency. Then you take a look at the BUN. Is the BUN normal? Is the creatinine abnormal? And so on and so forth. Take a look at the electrolytes. Once you begin to pay attention to the kidney, then you got to begin to pay serious attention at the electrolytes. That's crucial. It's got kidney abnormalities affects the electrolytes significantly. Okay, so you have to know that. Again, I repeat, you have brilliant, excellent nephrologists out there. I'll be more than happy to help you to handle that part of it, because there's a whole bunch of other stuff you need to know. Don't let this stuff stay and don't take care of it in the very beginning, so as to prevent things from getting worse, and let the kidney specialist handle that part of it. Then I forgot to mention that we should have done also a T4 TSH. Yes, an anti-thyroid antibody. Yes, that's where, and the endocrine part of it comes in. Again, if you're not good at stuff, please refer the patient to an endocrinologist to handle why a patient with lupus suddenly have abnormal anti-thyroid antibody with abnormal T4 TSH. That is telling you that this patient not just have lupus, the patient most probably have overlap syndrome. That is, the thyroid is involved as part of the autoimmune disease. The thyroid, certain segment of thyroid disease are autoimmune in nature. This is a multi-systemic disease. You can't just say, well, this is lupus, and I'm so smart, I want to take care of it by myself. It doesn't work like that. It doesn't work like that. Don't wait too long. Do it in the very beginning. Ask for help. Let the endocrinologist take care of it. And then one other thing that I do, I don't know if others do, I automatically look for thrombophilia. Every single patients of mine that I'm dealing with, I look for thrombophilias because I know they can have elevated lipoprotein A. They can have low protein C, low protein S, low antithrombin 3, and so on and so forth. You do that automatically, so this way people don't be walking around with things that they don't know anything about, and then suddenly that started clotting, because you're talking about a young lady, her GYN doctor may want to put her on birth control for one reason or another, not just to prevent pregnancy. Birth control pills are used as treatment for different diseases such as endometriosis, etc., etc. The GYN doctor take care of that, but it is not the job of the GYN doctor to know whether or not the patient have underlying reason why she should not be taking birth control pill. It is you, the internist, that's your job to have already screened her for all this stuff so that she doesn't touch. I recall very vividly teaching at Montefiore when Montefiore was involved in at Bronx, the hospital right next to Montefiore. And I was making around. And I was presented, this is a true story, I was presented in the morning around a 14-year-old Latina lady, young lady, completely paralyzed on the right side, and also aphasic for life because she took birth control pill. And it is clear that she must have an underlying thrombophilia that nobody knew anything about, and bango, she stroke. 14 years old. 14 years old. Finito. That's it. Okay. Paralyzed completely on the right hand side and totally aphasic. So this stuff is real. It's crucial. You have to know how to do these things. If not, ask for help. You can't just write prescription for people to take birth control pill in this day and age. For whatever reason you're giving it to them without realizing. Just last night. In fact, I think I still have it in my cell phone. An article came out on the AMA morning round about what I talked about last week, the disastrous situation that exists in terms of what's happening to, I thought it was 2 to 3, because they say 5 times more. 5 times more. Just last night, I read the article in the AMA around morning. At night, I look at these things. 5 times more minority women and children are dying as a result of peri-delivery problems that are associated in this country. This is the developed country, America. This is a developed, and yet these things are happening because of lack of knowledge, lack of people caring for these people. Sometimes the people don't go for the care themselves. Then if you cannot blame the doctors. They don't have the money. They don't have the insurance. They show up for help when they're 6 months pregnant. Things have already happened. Awful stuff has already happened. It is an awful thing. I recall being in my office years ago when I was just out of training and started my practice. Get a phone call from one of my colleagues to come and help. An 18-year-old is in the intensive care unit at the hospital up the street on Davis Avenue in deep trouble, bleeding non-stop. There is nothing they can do to make the bleeding stop. And I get called. Well, I was there until midnight after to try to save this lady's life, this young lady's life. She's got something called Courvoisier's uterus. I never heard about it. That is, something happened, she was pregnant, and I had to step in and insisted. And thankfully, the head of OBGYN, this absolutely brilliant man, unfortunately passed away. Brilliant, he was head of OBGYN. He said, Val, if you say so, I believe you. We must abort, otherwise she won't stop bleeding. The lady's in shock. They're pouring blood. You could pour all the blood you want. If you don't remove that, empty out the uterus, she's going to die. She's going to die. You could do all you want. And of course, he listened to me. And this is somebody who knew me when I was rotating in GYN years ago at Jacoby. So he just had a respect for me. And he says, Val, I'm going to listen to you. We're going to have to do it. We'll save this young lady's life. And we did. Get the uterus emptied out, do what we have to do. We stopped the bleeding. And that was so we saved her life. I never forget that. And this young lady, you don't want to know what happened. Okay. All I know is the fact I was involved. I didn't do it for pay. In fact, I had to be the one. There was an old pharmacy in the corner there at Post Road, across the street from where they're selling glasses now. I had to go there, use my own money to write prescription, to buy the medication that she needed to go home with. Give it to her. I was not asking for anything. I was just what I had to do to help this young lady. Never heard from her again. I'm not an OBGYN, but I saved her life because they listened to me. This stuff is real. This is no time for arrogance. This is the time for thinking process to set into place. As a matter of fact, I recall getting involved on all this major racial political garbage that was taking place at that time, that they invited somebody from Cornell to come to present the case. I was not invited. You can't make this up. I was not invited to be part of the discussion. While I'm told that this gentleman from Cornell was asking for, quote, can I get to meet this, quote, genius who did this? I was not invited because the person who was running the hospital at that time hated my God with a passion, and he wouldn't want me to get. I was not looking for praise. I saved this young lady's life. That's all I had to do. That's it. I'm not an OBGYN, but this gentleman listened to me, and we saved their life. So, if you don't understand this stuff, please, for God's sake, ask other people to help. The same way I was asked to help, and I step in, and your life was saved. I read that article last night. You could check it on the AMA morning round, they call it. 5 times more black women and other minority women, especially black and Hispanic, are dying in this country, and the children suffering and dying because of lack of care when they are delivering a baby in the United States of America. We're not talking about developing countries where people are dying of poverty and hunger. I saw this terrible thing on television, these young people, they were raped. You could count their rape because of hunger. Hundreds of thousands of children dying per month because of hunger across the world, because of starvation. So that's the world we're living in. While we have plenty, there are people over there had nothing. I know. I was one of those. That's why I was an orphan after my mother died. I had nothing to eat either. and I suffered, but I survived it. So I'm very sensitive to these things. Suffice it to say, you get all this stuff done, pay attention to the kidney, make sure you get an ultrasound, very easy, non-invasive, get an ultrasound that gives you an idea. Do the kidney function test, that's very easy to do, 24-hour urine creatinine clearance, you could do that very easily, give you an idea. Right? And then we got to talk about other part. As I say, we get an echocardiogram, because the heart inevitably can be affected. Get a chest x-ray, very important, get a chest x-ray. Get these things done, and then now that you know you've got a patient with lupus, because the double-stranded DNA is positive, whether the patient has some other issue associated with that given overlap syndrome, yes, you have to know how to diagnose those. Because now that you have that straightened out, you get the patient back. Now you have to treat the patient. If the patient have a dermatological problem, you send them to the dermatologist to try to handle that part of it. But you are in charge. You're the internist. If you don't know how to do this, please refer the patient to a rheumatologist. They're brilliant rheumatologists out there at all communities that will take over the management of the patient's lupus. It is not an easy thing to do. And if you don't know how to do it, you should have no business doing it, because it's very time consuming. You have to know what medication to prescribe. You have to know how to keep the patient, because the patient can become decompensated very quickly. So I myself, frankly, most of the time I refer them to the rheumatologist, let them take over from there. I did my part. I made a diagnosis, I have other things to do. Not that I don't know how to do it, that's besides the point. This is not an ego thing. Let the rheumatologist handle it. Let them handle it. And next week, I will tell you how this thing is to be handled. What are the medications that are available? What are the things that have to be done? What are the other systems, such as the blood system, that how to evaluate it and how to handle the blood system is completely, totally involved. That's my type of thing, because I'm a hematologist. I'll tell you how you go about handling that. Crucial. Again, once more time, I will explain to you again, insist and recommend seriously that you wear your mask, put your gloves on, keep your distance, wash your hand with soap or sanitizer, listen and stay away from crowd. Don't listen to the politicians, listen to the scientists and the doctors, so that you could avoid getting the COVID-19, which is a deadly disease. Until I see you again, this is Dr. Alcena saying so long and bye-bye.